is now the right time for me to have my surgery? The answer to that is it depends. And, and that is because patients fall into some very specifically different categories. Take the person who's had a badly arthritic knee or hip, and they've been slowly deteriorating over the past 3 or 4 years. And they decided now they're going to bite the bullet and have their joint replaced. They are not going to be compelled to want to come into the hospital until they feel that their risk of having any infection, whether it's COVID or anything else, is as if it was before the pandemic. On the other hand, they're the patients who we are seeing who have a newly diagnosed colon cancer or a pancreas cancer who have to have surgery as soon as possible. So the urgency on the part of the patient is a very important determinant of the way we answer this question. The real answer is that prior to COVID-19, all surgery had risks, but this was never part of the risk. Right now, we have a pandemic which looks to be on a waning trajectory. The question is, over what period of time will the risk become better and better? So if we look at where we have come to in terms of our ability to provide a safe environment for patients to have surgery, and what it will look like in 6 months or 1 year, will depend on two things. The one is the development of adequate drug therapy, which will mitigate any symptoms as quickly as they occur. And the other one is on the ability to provide a vaccine in which nobody has to worry about this disease ever again. So given that unknown time horizon, the patient who comes to me asking whether it's safe to have a joint replacement now or to wait 6 months or a year becomes an issue of, if your life is affected by the fact that you're having difficulty walking up your own flight of stairs at home or playing sport that you've been used to, we can provide the safest environment possible based upon what we've learned in how to protect patients from any form of infectious disease in the hospital. The question to the patient who has cancer is usually a little different because they want their surgery as quickly as possible. And to those patients, we have been operating almost throughout the pandemic. As soon as we had the ability to admit patients to a bed that was not occupied by a COVID patient, we were operating successfully and having unbelievably good outcomes in our cancer patients. So the answer to the question is, we're as safe as we're ever going to be for the foreseeable future. And I hope to allay those concerns so that you come back and have the surgery that you really need.